Thank you both. 8:08. We're live at the Peoples Health Medicare Center in Metairie. That's at the intersection of Vets and North Causeway, right by Party City. We're going to be here all day celebrating Medicare's annual enrollment period, which kicked off last Saturday, October 15th. Newell's going to be here from 10 until 1, and then Scoot's going to be here from 1 until 4. And sitting next to me, the man I talk to every Thursday morning, finally I get to meet him, Dr. B, Chief Medical Officer for Peoples Health. Good to see you and good to meet you in person.
It's great to meet you too, Tommy. I'm glad to have you here.
Well, we're happy to be here. Before we talk about the annual enrollment period, why don't you tell us a little bit about Peoples Health?
Yeah, sure. So, Peoples Health is a Medicare Advantage organization. We were actually founded in 1994 and have spent over 20 years really providing high quality, cost-effective health care, to anyone who has Medicare. And we now serve over 92,000 plan members all around the state. And we really try to build those plans, by easing access to care, by providing a face-to-face, personal, attentive Medicare team. That's why our members are really supported by those healthcare professionals who help to assist and coordinate their care. Sometimes we provide just simple reminders like annual screenings and things you need to get done. Sometimes, though, we have to actually work on more complex care coordination to make sure that patients get what they need when they need it so that they can really enjoy the best health possible.
Tell me, if you will, about this Peoples Health Medicare Center, because I envisioned it. I'd never been here, until I walked in. And I was blown away. This is a state-of-the-art facility. It's very, very nice.
Yeah, it's fantastic. I mean, you can tell the minute you walk in the door, a lot of thought was put into this, kind of the flow, how it goes. We actually opened up the center in October, and unfortunately, a lot of things went virtual all during the pandemic. But sometimes our members really want to come in and meet us in person and actually talk to us about their plans and what their thoughts are and everything. So the Medicare Center really allows them to do that. It provides on-site member services where our representatives can really assist you with any sort of issues you have with the health plan, but then also just answer any questions that you might have about benefits. And, it's accessible. It was pretty easy to get here myself, right at the corner of Vets and Causeway next to Party City. You can come in really any time that we're open and talk with a licensed sales representative.
It's close enough to Vets and Causeway where it's convenient, not so close where it's inconvenient.
Yeah, exactly.
It really is.
A couple of blocks down the street, it'd be harder to get in.
And I think there's nothing like sitting down, especially when it comes to Medicare and something complicated like that, and talking to somebody so you can ask their question. Because a chat on a computer is not the same as talking to a person, looking at them eye to eye and having a conversation with them. Do you guys host events here at the Medicare Center?
Yeah, absolutely. We host a whole variety of events. Some are educational programs about Medicare. We've got a couple of those today. Sometimes we try to focus on preventative health so that people can learn about some things they need to do to prevent diseases. Recently, we've had some classes on healthy aging, advanced care planning, and we do a great class that actually teaches people about how to use their smartphone apps because everybody has a smartphone now.
That's a great idea, and few people know how to use them completely or get the most out of them, I guess, with the apps.
Yeah, they really seem to enjoy it, so it gives them a lot of extra information, how to use it to the best of its ability. And then we host community activities as well. We have Medicare Bingo, which people get a kick out of. And then we've even had classes on decoupage and music therapy as well.
Like a senior center almost, huh? Kind of?
Yeah, it really is. I mean, it's a place where you can definitely come in. People can come and actually meet each other, meet other people in their age group as well. You can actually see all the upcoming events that we have listed on our website at peopleshealth.com.
And that's what struck me when I walked in. You could see that it was kind of like people-friendly, I guess, the best way to put it. Let's talk about business now, the annual Medicare enrollment period. God bless you. Can you explain what it is? Because I told you last Thursday, somebody down the street wanted me to try to explain it to him, and I got tangled up in everything, and it's like, just go to Peoples Health, please, because I'm going to mess you up.
Yeah, it can be like launching a rocket. It can be very confusing sometimes, but just to kind of simplify, the annual enrollment period, or what we call AEP for short, is the time of year where every year people can look at their plans and they can make changes to them if they feel like they need to. And AEP runs from October 15th, so it just started this past weekend, and it goes all the way until December 7th. And like I said, that's really the time where you want to look at your coverage and make any changes. Anything that you change will go into effect January 1st in the new year. And, really from year to year, health plans change what they offer. They change what their benefits are. So it's really important to review your coverage yearly. You want to make sure that a benefit that you use is not going away, or there may be a benefit that's added that may be something that you really want to get on board with. So it's really the perfect time to compare your plan and other options that are on the market.
How do you know about those changes? How do you find out what changes your Medicare plan's making for the new year?
Yeah, there's a couple of things that you can look for. So in particular, if you're on a Medicare plan right now, you should have received something called the annual notice of change. It's probably in your mailbox, or if you opted for it electronically, it's in your email. That document really lists all the changes one by one that the plan is going to change in the upcoming year. So it's a real easy way to say, okay, this is no longer there, this is now added to it. And then another document that you probably received as well is called an evidence of coverage. That's a more comprehensive document that actually tells you all of your plan's cost, all of the benefits for the upcoming year, and it really contains everything that you need to know about your plan for 2023.
If you have Medicare already, is this the only time of year you can make changes?
Typically, yes. So AEP is kind of the big time to make changes if you feel like you need to, but there are a few exceptions to that rule. So you can make changes outside of AEP if you qualify for a special circumstance. And there's a couple of those. In particular, one of the biggest ones is if you're just now turning 65. So if you're turning 65, you actually have 6 months before and 6 months after your birth month to make an election. You can also sometimes change if you have both Medicare and Medicaid. That allows you to actually select a plan at different times throughout the year. And then the other type we see is when people move outside of the area. So if you're in Louisiana right now and you move to either a part of Louisiana where your plan's not offered or out of state, then you get the option to pick another plan. And the last one would be somebody who maybe has been living in a nursing home or in a skilled nursing facility. If they come out of that facility and they want to choose a plan, then they can as well. But you want to make sure during this time period, if those things don't apply to you, this is really your only opportunity. So December 7th is your deadline.
Do you have to change your Medicare coverage every year or not?
Yeah, absolutely not. So if you've reviewed what's coming up in your plan and you're satisfied with it, you're happy with everything, then usually you can just stay in the plan that you are. You're not going to be automatically disenrolled or anything. You'll actually automatically roll over to the next year.
If you do want to change your coverage, what changes can you make during, you ready for this? The AEP.
That's good. You're
jargon,
learning.
The annual enrollment period, right?
We've taught you well.
There you go. That's right. I'm learning. Took a while, but I'm learning.
Yeah. So, there are several options. So if you currently have original Medicare, then at this time of year, you can actually switch to what's called a Part D plan, and that's a drug plan that would just cover your prescription medications. And if you're already in a Part D plan, you can actually switch what that plan is, or you can actually elect to enroll in a Medicare Advantage plan. So if you're already enrolled in a Medicare Advantage plan, you can either switch to a new plan, a new Medicare Advantage plan, or you can revert back to original Medicare and then choose a Part D prescription drug plan. I know that's a long list.
Well, no, I'm just laughing because they're trying to block the sun out, which is very nice, but it sounds as though they're adding a wing to the Peoples Health Center, which they're not really. Thank y'all guys for doing that, as a matter of fact. Difference between original Medicare and Medicare Advantage.
Yeah, so most people begin on original Medicare, and Medicare includes Parts A and B. I know we've had this conversation before, but pretty simply, Medicare Part A covers inpatient care. So if you go into the hospital or if you're in a skilled nursing facility, that's going to be covered by Part A.
And it's free?
That is free with Medicare. Okay. Yeah, with original Medicare. If you need outpatient care, which most people do, so that includes things like doctor's visits and surgeries and all the preventative services, that's covered under Part B. That's also also going to cover things like flu shots and screenings, things like that. And that actually does have a premium associated with it, so you have to pay for that.
Based on income?
Based on income, yes. And so original Medicare, keep in mind, it really only covers a portion of your healthcare needs. It only covers services that are medically necessary, and it doesn't cover any drugs at all, so no prescription drugs. And a lot of times it doesn't cover routine things you may need, like dental, hearing, or vision care. And so that's why a lot of people enroll in Medicare Advantage plans. Medicare Advantage is known as Part C. And what that really does is it combines Part A, Part B, and then joins in Part D. But it also gives you some extra benefits that are not covered under original Medicare at all. And that may be things like a fitness membership. It may offer you transportation to and from your doctor's visits, which can be very useful. And it certainly covers routine services like, teeth cleanings, eye checks, hearing aids, things like that. So it really is a more comprehensive insurance plan.
Teeth cleaning, even in my case, if I have to mail them in?
Yeah, you can definitely do that as well.
All right, good. Do those extra benefits make Medicare Advantage plans? Okay, well, Tim, I'm sorry. Tim's yelling at me, or we have to take a break. All right, well, let's take a break. We come back. We'll talk with Dr. B, Dr. Brent Wallis over at Peoples Health. We're here at Peoples Health. I'm so used to talking to him from the studio. Peoples Health Medicare Center, 3017 Vets in Metairie. We'll talk about these extra benefits. Do they make Medicare Advantage plans more expensive than original Medicare? Complicated stuff. Dr. B does a great job of walking us through it, Chief Medical Officer of Peoples Health. It's 8:19, time for traffic now on WWL. Quickly back to Dr. B, Chief Medical Officer of Peoples Health. So before, Doc, we were talking about Medicare Advantage plans. Do those extra benefits make Medicare Advantage plans more expensive than original Medicare?
Sure. So not necessarily. Medicare Advantage plans all come with different cost. So really, regardless of which plan you choose, your overall cost are going to be often lower than they are with original Medicare. And that's because Medicare Advantage plans are really required to limit your yearly out-of-pocket cost, while original Medicare really doesn't place any limits on that yearly expense. So, the extra benefits that Medicare Advantage plans give you actually keep you from paying out of pocket for a lot of those extra services you may use. And if you were under original Medicare, you would have to pay for them. So a good example is, routine dental cleaning. So you go to get your teeth cleaned. That could cost easily $100. And so people with original Medicare are going to have to pay that full $100. But if you're in a Medicare Advantage plan that's got dental coverage, you won't have to pay that. You may not even have to pay anything, depending on how the benefit is designed. So, for example, all People's Health plans have a $0 preventative and comprehensive dental service benefit. So for 2023, you'd get the entire $100 cleaning for free. And those savings really can add up. That plus all the other extra benefits that you have really can save you a lot of money on a monthly and a yearly basis.
Things like vision care, hearing exams.
Yeah, exactly. If you've ever been to get your eyes checked, that can be expensive, $100, $200, if you need glasses as well. So again, you can actually save a whole lot of money if you think about those extra benefits and decide if you really need them and you'll use them.
And what are some other costs associated with Medicare Advantage?
Yeah, so it really depends what plan you pick. Some Medicare Advantage plans have a monthly premium, so you'd have to actually pay monthly for them. And that's in addition to your Medicare Part B premium. But other plans, including most People's Health plans, you don't have a premium at all. So it's a $0 premium monthly. And then some plans even offer a Part B premium give back. And what that is that's where your health plan actually pays a portion of your Part B premium. So that really is putting money directly back in your pocket. And to give you an example, we have some plans that could pay you up to $60 each month back into your Part B premium. So that could save you $720 a year. So it's a significant amount of money. And then the other things you want to look at are the deductible, the co-insurance, and the co-payments for services that you're going to use. Things like prescription drugs or doctors you're going to be seeing. But again, those costs are going to vary by plan.
Due to my poor clock management skills, we're going to take a quick break. When we come back, we'll talk about what coverage option is right for you. We're live at the Peoples Health Medicare Center, 3017 Vets in Metairie. You can come in. People are waiting to talk to you one-on-one. They also have group presentations at 10 and 1 if you're more comfortable with that. Tommy Tucker with Dr. B. Back in in a flash here on WWL. Thank you, ladies and gentlemen. Peoples Health Medicare Center, 3017 Vets in Metairie. That's where we are with our friend, Dr. B, Chief Medical Officer of Peoples Health. Nice, again, to talk to you in person. We're talking about choosing Medicare Advantage plans. So how do you choose what coverage option is right for you?
So there's really several things you want to consider when you're either deciding between Medicare Advantage plans or you're trying to decide if you want to switch off of original Medicare. And so the first one is the cost. That's one of the most important. You know, what's going to fit your budget? What can you spend per year? What do you want to spend per year? So you really need to look at the deductibles and that monthly premium. And then the second thing you want to think about is what kind of coverage do you need? So, you know, are the doctors that you're seeing in the plan's network? Because Medicare Advantage plans usually have a network that you have to abide by. And then what drugs are you taking? And if you're on certain prescriptions, you want to make sure those are covered too, because if they're not covered, you're going to be paying a lot more out of pocket. And then the last thing to think about is those additional benefits we were talking about. So things like dental, vision, or hearing, you know, do you need those? You know, pretty much everybody needs dental cleanings, you know, and everybody should get a vision screen. If you've got hearing problems, you want to make sure you have availability of hearing aids as well. So that's the other thing you need to really look at.
Somebody texted in, what if somebody signs up for a Medicare Advantage plan, but they don't like it? Are they stuck with the plan until the next AEP, which I know means annual enrollment period?
Exactly.
Mm-hmm.
So no, the short answer is no. I mean, ideally, any coverage that you choose, you're going to really be happy with. That's the hope. But if you do change your mind, kind of like a buyer's remorse, then you do have an opportunity to either return to original Medicare or to enroll in a different Medicare Advantage plan. And that's actually a separate period. It's called the Open Enrollment Period, or OEP. And that runs from January 1st to March 31st.
Hang on a second. OEP. We're going to take a quick break. We come back, we'll talk about star ratings. We're here live at the Peoples Health Medicare Center, 3017 Vets in Metairie. Noel's going to be here next from 10 until 1. Scoot's going to be here from 1 until 4. The people are here right now ready to explain Medicare to you. So if you maybe took your walk already on this beautiful day, come on in. They are open a little bit early. They'll talk to you one-on-one. They'll answer any questions you have. Again, we're not selling timeshares. Nobody's going to arm ring you to sign up for People's Health. They're just trying to educate you about Medicare. And they're going to have group sessions at 10 and at 1. So if you'd be more comfortable in a group than one-on-one, you can do that. Back in a flash, WWL. Tucker, WWL, live at the People's Health Medicare Center. WWL is going to be here all day long. Tim, what is that music? That's very classy. Boy, Dr. B deserves that kind of music. 3017 Vets in Metairie. They'll be here all day, and Noel's coming up next. And then Scoot, we're talking about star ratings with Dr. B, Chief Medical Officer of People's Health. So should you consider a plan's rating when you're looking at coverage options, and what are these star ratings all about?
Yeah, so you absolutely should consider it. Medicare actually developed the star rating in 2008, so it's been around for quite a while. It was designed basically as a simple, unbiased way to evaluate a health plan's quality and its performance. And so every year, Medicare actually rates all Medicare Advantage plans and Part D prescription drug plans on a scale of 1 to 5. And in general, the better a plan performs, the more star it receives. So 5 is going to be really excellent performance. 3 in the middle is kind of average performance, and then 1 is going to be poor performance. And so when you're comparing plans, if they're similar in cost and the coverage that they offer, you want to look at the star ratings, because if you choose a higher star rating, it really does mean a higher quality plan.
But it's easy to jump to the conclusion that 5 stars could be the best. Is that necessarily true?
Yeah, it's, not always. 5-star definitely means they have a high level of member satisfaction. And the problem is health plans are really not one size fits all. And so people need different things. That's why it's so important to really review the star ratings, but also what do you need in coverage? Who are your doctors? What are you going to need out of your health plan? So a higher performing plan may not really be a good match if your doctor's not on that plan. You want to go with something else.
And I get shots in my eye if that medication, for whatever reason, would not be covered with one plan, then I would want the plan under which it's covered.
Exactly, yeah. You'd want to go with the one that's going to provide you better coverage.
And how does Medicare determine those ratings for the plan?
Yeah, so, excuse me, every plan is rated on about 40 unique quality and performance measures. So it's a pretty extensive rating system that they do. But they're really focused into 5 different areas. So they look at how well the plan actually helps its members get preventative care, things to help you stay healthy, how well they really handle chronic care issues. So that's helping people with diabetes, hypertension, long-term issues. How good the member experience is. So are the members satisfied with the health plan? And then how good is the customer service? Are they able to get in touch with somebody when they need to? Are their issues handled very well? Any sort of grievances or appeals that they have? And then the last part is actually Part D coverage. So the prescription drug plan is very important. Is it providing safe and cost-effective drug coverage?
It is okay to think of Part D as drugs. D, that's what it's.
Yeah, D is for drugs.
Okay,
yeah, I don't know if that's why they picked it, but it works.
It does. It is accurate, right? Okay.
Exactly.
So one of the star ratings announced.
So the star ratings are announced every October, and they actually in October they're announced, but they apply to the next year. So the ones that were just announced in October are actually effective for 2023.
So it's hard to get a 5-star rating.
Very hard to get a 5-star rating. And most people's health plans were rated 5 out of 5 stars in 2022. And we're really excited that, again, for 2023, we are rated 5 stars as well.
And to be clear, there aren't a lot of those, are there?
No, there's very few. In fact, actually, across the country, there's really only about 11% of the Medicare Advantage plans are 5 stars. So it's really rare.
And they're not necessarily more expensive, are they?
No, they're really not. The stars does not determine what the costs are associated with the plan. So, for example, most of the People's Health plans are a $0 monthly premium and have $0 annual deductibles, but they are 5-star.
But there are different enrollment options for a 5-star plan. That period changes?
Yeah.
We got AEP and OEP. Do we not have a 5-star P?
We do. We have SEP. Okay. Is actually what it is. And the S actually stands for Special Enrollment Period. So, normally, like we said, it's from October 15th through December 7th is your AEP. But the SEP actually allows you to enroll once in a 5-star plan. So you can actually choose to switch from your plan to a 5-star plan during that special enrollment period.
So how can you find out more about a plan's star rating?
So the best place to go is really the Medicare.gov website. They have a really nice plan finder tool where you can put in what your doctors are, what your drugs are, and what you're looking for, and it'll list all the plans in your area that are available. And next to the plans, if they're 5-star, there'll be a little gold star that's right next to them. The other thing to keep in mind is if they're a low-performing plan, that will actually be noted on there as well.
Tell me what's going on today here at People's Health Medicare Center.
Yeah, so really today what we're trying to do, we've got our whole staff actually sitting here waiting for people to come in.
Say hi, staff.
Okay. There we go. They're doing a great job there. We've actually got quite a few potential new members and people coming in to really learn about Medicare, what Medicare means, and what their plan options are. So they're really here to answer your questions and help you any way you need.
Presentations at 10 and 1 today, and there are going to be some presentations other days as well?
Yeah, exactly. So at 10 and 1, we actually have in-person presentations right here. So come by and check those out. But we've actually got all the way through December, we have a whole lot of virtual presentations and some events that are scheduled here as well.
Go to peopleshealth.com/meetings to find out more. Dr. B, a pleasure to meet you in person. It really was.
You too, Tommy.
Nice talking to you. All right, we'll take a quick break. 8:53 traffic now, WWL.